Welcome to Volunteers in Medicine's first virtual Hands Together Gala, celebrating 11 years of serving our community. I'm so happy that you could join us. In the history of medicine, we will always look back and see that in the early 21st century, it was divided into two distinct eras, before the COVID-19 and after. In my 35 years of practicing medicine, I have never seen anything like the COVID-19 virus. The world has never seen anything like it. It has caused all of us to pause and appreciate how fragile and precious each and every life is. I have never seen the world appreciate their healthcare workers more. The term health heroes has become a household expression. But did you know that in just the past 8 months, more than 1,000 healthcare workers in America have lost their lives in the front lines? Doctors, nurses, and caregivers of every kind. My own obstetrician who delivered both my children got the COVID-19 in his office, as did I. He, like myself, thought we had many more years to practice medicine. Little did he know, God would call him home so soon. I thank God every day that even though I had a brush with COVID-19, I am still here to love and serve, especially the less fortunate. This public health emergency has upended every aspect of life, and in the process peeled back the layers of inequality and laid bare countless faulty systems such as our healthcare in America and in the world. At Volunteers in Medicine, we have always served the marginalized and forgotten people in our community. They are the same people who have become disproportionately the victims of this plague. Those people in our community without access to healthcare, Hispanics, African Americans, and the working poor. We thought the 2008 depression was horrible, but in addition to public health crisis, the economic crisis the pandemic has caused is unlike any since the Great Depression. 25% of U.S. workers filed for unemployment in a mere 2 months. Workers have lost twice the number of jobs as in the Great Recession. In Nevada and Las Vegas, 1 in 3 people have lost their jobs and their health insurance. More than ever, Volunteers in Medicine needs to be here. In this next few years, we will have many challenges to bring the much needed healthcare to so many in our community. As in the past, Volunteers in Medicine of Southern Nevada will meet that challenge because of you and your community supporters. Today, at this moment of unprecedented medical and economic crisis, it is all of our obligation to take real and meaningful action. There has never been a greater or more important time to do so. To those who are very blessed, much is expected, and we have the responsibility to help those who are struggling for their lives. Volunteers in Medicine is their safety net. Let us remember that in these times of cascading crises, Volunteers in Medicine, supported by concerned citizens such as you, needs to take collective and effective action that would ensure that the post-COVID-19 era is a moment that not only will address the problems in our community, but start rebuilding a world filled with equality and justice for all, where everyone receives quality health care because every life matters. I ask you, please, give so that others may live a healthy, productive, and long life. Thank you.